Hi students, hello all of you, good evening, how are you all? Hi students, so today's class will be starting with the session 3 of Human Health and Diseases. Okay, so this Human Health and Disease, this chapter I said already is very important because from the examination point of view. Okay, so this chapter is very important. So I wanted you all to concentrate on this topic. Okay. So this is a very important concept and topic. Okay students. So that I would like to tell you all. So please concentrate on this topic because last exam we had around some 12 to 15 questions from this chapter. So you can just make marks out of this chapter. So please concentrate on this chapter. So before starting with this session, let me have a small quick revision of the last class. And I want you all to interact in this session. Okay. I'll ask you a question. Okay students. Okay. Yes, cheer up. Come on. I wanted you to answer this question. Let me see. Okay. What is the organism that causes syphilis? What is the causative organism that produces syphilis? Yes, please reply in the chat. So please start replying in the chat. We are waiting to see your answers. Yes, please put it in the chat. The organism. Yes, very good. Somebody started answering. Yes, very good. Excellent. Some more people. I wanted everybody to participate. Please, all of you start answering. Yes, very good. Treponema pallidum. Yes. Yes, very good. Okay, excellent. So now we will go on with today's topic, the human health and disease, okay, the session 3. Now in today's class we are going to see about the common disease and causing agents. So we saw in the last class about the bacterial diseases. Yes, in today's class we are going to see about the viral disease and the fungal disease. So we have so many agents that cause diseases. We told them they are called the pathogens. Okay. So we are going to study about each pathogen and what are the disease they are going to cause. So in today's class we are going to see about the viral diseases as well as the fungal diseases. So coming on for viral disease, can anybody name some of the viral disease that you all know? I hope you will come with the answer fast. Name some viral diseases, students. Put it in the chat. Put it in the chat. Yes, name some viral disease. Please start putting it in the chat. Let me see what are the disease that you people. Excellent. Viral hepatitis, AIDS, chickenpox. Very good. Yes, excellent. So these are some of the viral diseases that we all know, like chickenpox, measles, AIDS. You all forget about corona. Yes, the COVID-19, even that is also a viral disease. So in today's class, we are going to see about what is a viral disease, what are the viruses, what is the symptom, and probable treatment or prevention for the diseases. So now look into this picture, children. As you all see, yes, you can very well see here. Yes, excellent. Very good answers you people gave me. Excellent. Very good. Sri Lakshmi, Neelambari, Sri Vatsav and all. So here you see, before understanding about the viral disease, I wanted you all to know about certain processes or the steps in which how a virus would enter into a host cell and it is going to replicate. So that we are going to understand. The first part what we call is the binding. Okay. Here the virus will attach to an immune cell. Next, this viral core whatever will enter the T cell and it will fuse with the cell membrane. Now what will happen? The next step is the reverse transcription, which is done by the enzyme reverse transcriptase. Okay. So there will be copies of the virus RNA will become the DNA. The next step will be integration. That is, the newly created DNA will get incorporated into the host cell. Okay. By one enzyme integrase. So that will get integrated. Now what will happen? Everything will become mixed up here. The next step will be the transcription, where the mRNA will start using this DNA. They will start to produce. Now in translation, this infected, that mRNA will come out of the nucleus. Okay, and then that long chain of that viral protein, enzymes, everything will be formed. The next step will be called assembly. Okay, what is assembly? The RNA, the enzymes. Okay, so all these will get gathered up at the edge of the cell. That we call it as assembly. Then slowly the new virus particle which is incorporated in the host cell, okay, they get pinched off. They will form a bud. They just get pinched off or break away, and then with the virus that will just come out of the cell. So this is how they get themselves multiplied and spread throughout the body, where the host cell will not get destroyed. So you have to understand here in the concept. Okay. So what is that? The first step that is happening here. So you should know that the first step, what is happening here is the binding. So what is happening here? We call it as binding, where the virus will attach with the host cell. Then slowly they will fuse with the membrane. Okay. And then they are going to enter. That is, they are going to undergo what is called the reverse transcription. So here the RNA made to DNA, and then we have what is called the integration. So this is integration. So slowly it is getting integrated into the host cell. So next what will happen? Then the copies will be made, the transcription. Then they are going to come out of the nucleus, translation. So all these long chains, okay, all these long chains of what? That viral proteins, everything will be getting assembled here, and slowly they will pinch off, and that is how they are going to enter into the host body. So these are some of the basic steps that you should know. Binding, reverse transcription, integration, transcription, translation, assembly, and last is the budding and maturation. So all these steps is the one that takes place when a virus enters, because we know that they are all like obligate parasites. Like they don't have their own cell machinery, they don't have their own metabolic pathways, they don't have anything of their own. So they totally depend on the host cell for everything. So they will have only the nucleic acid, which will be covered by one protein cap. a coat. So they have nothing else. So this is how they enter the host and they capture. They are like terrorists. They will attack inside. They will take the entire thing under their control. So they are very quiet, dangerous. Now we will see about the viral diseases and how they are classified. So when you look into the classification of viral disease, we are going to look on the mode of transmission. So depending on the mode of transmission, what do you mean by mode of transmission? Like how it is passing from one person to one other person. So that we call it as the mode of transmission. Okay, so that you have to know. So what do we have to know? Here the transmission is through respiratory tract, through the gut. Okay, so it can be through the respiratory tract. So again it can pass through the respiratory tract, or it can pass through the gut, or through any bruises in the skin, or some animal bite, or through the genitalia. So transmission through respiratory tract, like can you think of some disease? Anything that is striking? Can anybody? You can put it in the chat box. I am waiting. Yes? Yes, please put it in the chat. Yes, I want to see your answers, please. Yes. What are the viral disease that can affect your respiratory system? Students, please come up with some answers, some ideas. Yes, let me see. Yes, very good. Corona, excellent. So the topic of the day, COVID, wonderful. Okay, then anything you can think about transmission through the gut? Anything you can think like that? Anything you can think like that? Through the gut? Any disease? Through the gut? Any idea? Any idea? Yes, you have come with pneumonia, COVID, flu. Excellent. Excellent students. Apart from that, through the gut, anything you can think? Any example you can give? So you have come with COVID, some have said flu, some have said common cold. Okay. Can you come with some examples that passes through the gut? Yes. 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 Can you come with that answers? Yes, students. What about polio? They are all examples that is transmission taking place through the gut. What about transmission through skin cut or animal bite? Rabies. What about through the genitals? The herpes. So we have like these so many viral disease that will have each have their own mode of transmission. So that is what we are going to see. Okay. So that you should all know. So that is very important. Okay. So very good. So now we will see about how it is getting transmitted through the respiratory tract. So we have first what is called the influenza. So influenza, like you should know that in influenza, we will see first what is the organism that is causing the particular disease. Then we will know how it is getting transmitted. So that is the second point you all are going to tell me. The third, we will see once when the organism enters, what are the symptoms. Then we are going to look for what is the cure, the treatment or any prevention vaccines we can give. So first it is the influenza. So in influenza, the causative organism, we call, what is that? It is the mycovirus, or we can say it is the orthomyxovirus. Okay. So it is the influenza virus, the mycovirus or the orthomyxovirus. So it is the influenza. Now influenza, when we say, like, it is such a contagious. Like influenza, recent we had that swine flu, H1N1, right? So that is very contagious. And how it is going to spread? It is going to spread through the droplet infection. So droplet infection, like it is a airborne, so it can be transmitted from the infected person to the healthy person through the droplet infection. So what will be the symptoms? So imagine the virus has entered. What are the symptoms? First, the person will get the sore throat, fever, body ache. They will have the muscle pain and discomfort and all. Sometimes they will have nasal congestion and all that. So what is the treatment we give? We give antiviral drugs, okay, and we will mainly take care that the contact of the object of that infected person should be handled with care, like hygiene. So that we have to take care. So washing with the disinfectant and all that has to be taken care. So influenza vaccine is also there to prevent this. So influenza is transmitted through the respiratory tract. What is the organism? Influenza virus or orthomyxovirus, or it is a mycovirus. Okay, it is a contagious. Think of H1N1, the swine flu. Yes, we had that recently breaking up and making an issue in the world. So it can be transmitted through the air droplets, the droplet infection. And what are the symptoms? Definitely when there is an infection, fever, sore throat, body ache, muscle pain, nasal congestion, all these are symptoms. So we are going to give them antiviral drugs, and that is another thing, the hygiene. We have the influenza vaccine. Okay, shall I move to the next? Okay. Now when you look into this influenza, see, look at this. Okay, this is the inner core material of it. So you can see that the hemagglutinin protein of that virus will make it attach to the host. Then they have some chemicals like neuraminidase. So that will enable them to enter into the host cell. And there are some special ion channels also that is needed for the replication, and some RNP, ribonucleoprotein, that is having this genome. So there are steps in which an influenza virus will go attach itself to these cells, particularly the respiratory epithelial cell, okay, by releasing some chemicals, and that is how they are bringing about such a vast, wide spreading infection affecting mostly the entire system. Then we have the next interesting viral infection that can pass through the respiratory tract is chickenpox. I hope everybody, when we were small, everybody would have got this chickenpox. So it is caused by the varicella zoster virus. So what is the causative organism? It is the varicella zoster. So here you should remember that in chickenpox, it is going to affect your respiratory, not the lower respiratory like influenza. It is going to affect your upper respiratory tract as well as the skin and the conjunctiva. So here it is very, very common in children. Okay. And what will be here, how it is spreading, either by the droplet infection or by the direct contact. That is why when one kid gets the chickenpox, we will not allow the other child to get mingle with them, because it can spread through direct contact or it can spread through droplet infection. So that you all have to, they'll ask you in the exam, what is the mode of transmission of chickenpox? It is either direct contact or droplet infection. Now what is the symptom? Here the child will develop fever, okay, they will have like this, see in the picture, small pink colored lesions you can see. So they will crust and become dry later. But one thing you should know, that in chickenpox there will be no scars, mostly no scars left in chickenpox. And we will treat this with the vaccine, the varicella vaccine, which we call it as zoster immune globulin vaccine. ZIG, Zoster Immune Globulin Vaccine we give for treating the chickenpox. Okay, so chickenpox caused by the varicella zoster. Okay, it's a very highly contagious. Mostly it is going to spread through the direct contact, or it can spread, okay, it can also spread through, how you see, it can spread through, like you can see through the droplet infection or through the direct contact. So very common in children. But here what happens, they will have all the symptoms of a viral infection like fever, they will have what you call that muscle pain, body ache, everything will be there. But they will have skin lesions, which is very characteristic. And after 10 or 14 days, they will crust and become dry, but no scars left. The treatment, usually we give the varicella vaccine, which we call it as ZIG vaccine, Zoster Immune Globulin. So that is the vaccine we will prescribe. Okay students, I hope you all understood. We saw two diseases that is going to be caused particularly by passing through the respiratory tract. So what are the disease? Okay, what are the disease? We saw one is influenza, the other one we saw is the chickenpox. Okay, can anybody tell me what is the influenza, which is the virus that affects, excuse me, what is that virus which affects that influenza? Please put it in the chat. Please name the causative organism. Please answer. So what is the name of that, what you call the virus? Yes, excellent, Anandita, very good. Mycovirus, yes students, Aravind, very good. So it is the mycovirus. Okay, it is the orthomyxovirus. So that which causes the influenza. Very good children, good, keep it up. And others, I want everybody to participate. Okay, we'll have good interactive session today because it is an interesting viral disease. Because when we see a bacterial disease, we quite have an n number of remedy. When a patient comes to us, we have a good number of diagnostic tests. But when it comes with a viral disease, okay, here we sit with it like what is that drug regimen we need to follow, all that matters. Okay, so next comes the measles. Measles also, see, I think you would have come across measles also. Okay, so this measles is a very highly infectious. We also call this as the rubella disease, which is caused by the organism, the rubella virus. They belong to the family of this Paramyxovirus. So this is the rubella disease or measles. It is caused by the rubella virus. Now you should know that how this disease is transmitted, probably by droplet infection. So here also when a person cough or sneeze, that infected person, through the droplet it is going to enter into the healthy person, and with a incubation period of around say 1 week they will contract this disease. So what are the signs and symptoms? Here they will have fever, cough, running nose. The skin, they will have these rashes with sore throat and all, and characteristic in the mouth, they will have tiny white spots. So that is very characteristic of the measles. They will have like reddish eye, which we call it as bloodshot eyes, and that white spot is characteristic in measles. They can ask you this, in which viral disease they will have that tiny white spots inside the mouth. It is the measles. Okay, so you should remember. Okay, so there in chickenpox you will see like small dewdrop like lesions. Here it will be like rash. Okay, they will be just like that rash will be there. Okay, so what is that we give for measles? we give the MMR, the vaccine to prevent measles, mumps, rubella. So we give for measles, then we give for mumps as well as for the rubella, the German measles. So this is the vaccine we give to treat the or prevent the development of measles. Okay. Now you see mumps. I hope you all know that just below here in front of the ear we are having what is called the parotid gland. The parotid gland is a salivary gland. Okay. Now what is happening in mumps? Okay, which we call it as the infectious parotiditis. Parotid gland is getting inflamed. So parotiditis. Anything with itis means inflammation. So there is infection. Your parotid gland is inflamed. See in this person, what is happening in him? See how much swollen here? Yes. So there is an infection in the parotid gland. Infectious parotiditis. So it is caused mainly by the paramyxovirus. So it is by the paramyxovirus, and you have to know that here the person, again it is because of droplet infection. Same like coughing, sneezing, all these activities will push him to develop the mumps. So what are the symptoms? The person will have here headache, body pain, swelling in the parotid gland. So you can see a characteristic swelling here. So your parotid glands actually they will be like this. It's located here. So there is an inflammation, you can see the swelling here. So how can you prevent this? You give the MMR, measles, mumps, rubella vaccine. Okay children. So we have seen totally now 4 diseases: influenza, mycovirus, then we saw chickenpox, varicella, zoster. Then third one we saw measles, paramyxo, that is the rubella virus. Fourth, mumps, paramyxovirus. So what is the protection that you are going to give for measles and mumps? MMR, measles, mumps, rubella vaccine. Now we have the fifth one which you all answered in the beginning, common cold. Excellent. So common cold, you would have seen somebody who have common cold in the class, everybody it will start transferring. In viral disease children, one thing you should understand that how do the people they get these sort of infection? The first is the immune system is not doing its job perfectly. Whenever there is a weakness that is present in the immune system, it will provoke or it will make the person more prone or chance for him to develop the viral diseases. Even when you give this antiviral drugs, their immune system should be competent. Then only he can himself protect from developing such disease or get treated from such disease. So you can see here in common cold, the common cold which we call as the rhinitis, which we say. Okay, so mostly rhino, the nose, itis is inflammation. Here it is mainly by the rhinovirus. So probably they spread through the droplet infection, and here you should know that probably it spreads through the direct contact or the respiratory infection. So suppose for example if he is having a cold and he touches all the table, the books, pen and all that, and he is just giving, so by contact, direct contact, or it can spread all through droplet infection also. So it is going to mainly affect your upper respiratory tract and not the lungs, like how you see in influenza and all. So what will be the symptom? They will develop mild fever, they will have congestion, sometimes watery discharge from the nose, they will have severe body pain, sore throat, tiredness. So that will be the usual symptoms. So the common cold, as of we don't have any vaccine, you should have a good working immune system to protect against all these diseases. So we say that the coronavirus, they are also responsible for causing common cold. But what that COVID-19 is doing is something different. So every virus, the strain, their species, everything would vary. So normally this will infect the epithelium that is lining the respiratory and the digestive tracts. Then we have the another disease that spreads through the respiratory tract is the smallpox. I hope you would have heard about this variola virus, which we call it as the smallpox virus. Now this is spread by the variola virus. Now one thing which I would like to tell you, in our medical history, smallpox is the first disease that has been totally eradicated. Okay, so what happened? This disease was like a big pandemic, like how we are having now COVID-19. Smallpox was giving a very high number of death rate. The infection, first what happened? The variola virus enters the person body. They will develop what we call the fever. They will have like this blister like pustule filled with fluid all over the body, and slowly it will start spreading everywhere, affecting the entire body system, and the person dies because of this infection. So it was completely eradicated from the world. In Somalia only it was the last case reported. In India 1975 was the last case. For one lady it was reported. After that the smallpox was completely eradicated. So how was it done? The magic or miracle was done by the invention of vaccine. The entire credit goes to Edward Jenner. Okay, he saw, let me teach you that story in vaccination so you don't forget. So here Edward Jenner, he was the one who developed the vaccine against this smallpox. So once when they were inoculated with this, it started to come down and simultaneously the infection was prevented. So they can ask you, which is the first disease in the medical history that has undergone the complete eradication is smallpox. Okay, by 1980 the WHO announced the complete eradication of smallpox. So smallpox, the variola virus, the vaccines are there and it is completely eradicated. So here the people will develop such a high fever, and spread is again direct contact or droplet infection only, smallpox. So there was, but one thing you should know, which will leave the scar. I said in chickenpox there will be no scar, but here in smallpox scars will be there. You can see the scars will be there, that definite scar will be present there. So that is characteristic of smallpox. So that you have to know. Okay, so far we saw about all the disease that which is going to pass through the respiratory tract. Influenza mycovirus. Okay, then we had chickenpox, varicella zoster virus, but there will be no scars. We are giving them the Zig vaccine, zoster immune globin. Then what is with measles? The rubella disease, rubella virus. Okay, it is the rubella virus. And what is the vaccine we give? MMR, measles, mumps, rubella. What is for the mumps? Infectious parotiditis. The parotid gland is becoming inflamed because of this virus. So we give MMR as a protection. Then common cold, rhinitis, rhinovirus. It affects your upper respiratory tract. Okay, that you have to know. Then smallpox, completely eradicated. Variola virus, so there will be scars present. That is what difference between the chickenpox and smallpox. So completely eradicated. The last case 1977, in India 1975. Then it was because of that vaccine which was given by Edward Jenner, the smallpox vaccine. Okay students, so far you are able to follow this. Now a small question to your mind. Please answer me. What is the difference that you see between the chickenpox and the smallpox? Please put it in the chat. The difference that you see between the chickenpox and smallpox. What is the difference? Please share it in the chat so that we can see. Yes, please come with the answers. I will be very happy. Yes, very good. Scars. Yes, Nidarshana. Excellent Nidarshana. Yes, with the scars. Then, what about the type of lesion? There you can see a dewdrop like lesion in chickenpox, whereas here it will be like rashes. So that is also a difference. Another, in smallpox, we will have that fluid filled blisters, whereas here dewdrops like lesions we will see in chickenpox. Yes, excellent. Chickenpox doesn't give rise to scars while smallpox does. Yes, students, you are all right. Excellent. And apart from that, think of the skin also. In smallpox where I showed, look at the skin. It had all that blisters. Yes, with fluid filled. But what about in chickenpox? It is like a small dewdrop, reddish, rose colored skin like lesions. But there it is like pustule, like blisters. It will come with fluid filled thing. Okay, that you have to remember. Excellent, students. Very good. So next, coming on for, we have what is the transmission through gut. I hope how many of them have come across this case, I don't know. But when we are in UG period in our college, we have come across so many cases of poliomyelitis. But now we don't see such cases of poliomyelitis. Even among the school group, 1 or 2 child will have a polio. But nowadays we are not seeing much of polio cases. We will see what is this about. So when you see about this polio disease, it's actually, we call it as infantile paralysis. Okay. So what is happening here? First, it is caused by the polio virus. It is also called the enterovirus. Entero means what? I told you on the day itself. It will affect your small intestine. Enteron. Gastroenterologist. Why do you say them like that? Because they see the stomach, they see the intestine also. Gastroenterologist. So enterovirus. Okay. So that is going to go into the gut. Now this infection, how it is spreading? They say it is by the fecal-oral route. Very, very important MCQ question. Fecal-oral route. So through the contaminated food, water, that is how they go affect. Now another thing which I would like to show you here is, imagine this is the nerve. Acha? So we are having the nerve. Now this virus, okay, the virus, okay, I'll just show you in another color. Okay, we'll take the virus. Now this virus, what it does is, it will just enter into these nerves. Okay, they will go in the nerves as impulse. They will just go in the opposite direction and they will damage all the neurons where present in the spinal cord. So like that they will damage all the neurons that is present in the spinal cord, and they are going to cause paralysis. So once when the nerves are affected, what will happen? The muscles will become paralyzed, mostly paralysis of the legs, and that is why we call this as infantile paralysis. So students, poliomyelitis is something affecting the infant age group. So it brings about the paralysis. Okay. So what is happening here? It is caused by the virus enterovirus, or it is called the polio virus. So the infection is going to spread through the fecal-oral route. So this virus is going to enter the nerves. It is going to go in a retrograde direction. We say retrograde means what? Opposite. It will be transported, go and affect all the motor neurons. Where? In the spinal cord. So once when the nerves are affected, the muscles will be paralyzed, and that is why there will be paralysis of the leg, and so the child will have total paralysis, okay, with the deformity. So next we have, how are we going to prevent? Now the government and the WHO as well as most of the health programs, they are wanted to eradicate. So we are near eradication. I hardly see a case of polio. So we are near eradication from India. So this is possible by, they can ask you, the name of the program is Pulse Polio Program. So what we give what is the polio vaccine. See, polio vaccine actually See in this picture, they are giving oral. When it is given oral, we will say this as Sabin. If it is a oral vaccine, we say Sabin. If it is injectable, we will call it as Salk. If it is injectable, it is Salk. If it is given orally, we will say Sabin, oral polio vaccine. So you can see that particularly in the month, we have that January and that November, December, we have that Pulse Polio program where we used to conduct camps, and we have to particularly we choose that infantile age group and we will give the polio vaccine. So that is why we are able near eradication in India. So you are all able to follow this poliomyelitis. Yes. The next is hepatitis. I hope many of them we have been vaccinated against this hepatitis. We don't know what it is, but we are all have got protected ourselves from getting this hepatitis. So when you see this hepatitis, there are hepatitis A, B, C, D, G, even E have been reported. And one thing you should know, that hepatitis A is mostly through the contaminated food and water. So it will bring about mild changes in the liver. So they are not going to bring about, say for example, like some chronic hepatitis. So it is a degenerative change in the liver. But what about the hepatitis B? The mode of transmission is different here. Here it is going to be through same like AIDS, like sexually transmission, or it can be through syringes, contaminated needles and infected blood, body fluids. So that is the mode of spread of hepatitis B. And another thing with the C and D also is through the same. The hepatitis B antigen, we call it as the virus as Australian antigen. Okay, so that is a name they have given. So please take it down. So hepatitis B is because of all the virus is what? It is because of hepatitis. But you have A, B, C, D and all that. Okay, so totally 6 we have. Among that, the A is totally different. The person will come with presentation of jaundice, vomiting, abdominal pain, like that. But what about in case of hepatitis B? It is something very serious. It is not a joke. So it is something serious for hepatitis B. So they are going to come here with the symptoms like there will be no headache, but there will be a liver damage. That is where we are very much, the physicians are concerned. So same way with the C, D and all, same mode of transmission. But what is the difference there? The difference will vary with the severity in damaging the liver. So that is where it is important. So hepatitis, it is the hepatitis virus. Type A, it is through contaminated food, water. But what about the other type when it comes? Particularly B, sexual contact, some blood contact, okay, blood transfusion. You are not checking properly for hepatitis, you are just transfusing. Okay, so that could be a reason. Or it can be sharing of syringes, contaminated needles. Okay, so that even transplacental also. So this is how the hepatitis B spreads. So we have vaccines. So that is how we take vaccines against that. So people who are in medical profession or even people who are more prone to develop, we give them these vaccines. We have vaccines for it. So now we saw about transmission through gut. We saw 2. One is poliomyelitis, enterovirus. The second one we saw hepatitis, the hepatitis virus. What is hepa? Liver. Itis, inflammation. Inflammation of the liver due to viral infection. Okay. So next is cut or animal bite. So we have the dengue fever. I hope you would all have heard about this dengue, which was quite prevalent like last year and all, which is also called the breakbone fever. So the dengue fever is also called the breakbone fever. So mostly this is by the mosquito. So what is the mode? You can ask me like, ma'am, what is the mode of transmission? So here we have this dengue virus, okay, which is called the flavirribovirus. We call it as flavirribovirus. So it is going to spread through the Aedes aegypti and Aedes albopictus. This is Asian tiger mosquito. This is called Asian tiger mosquito. So students, as I keep telling the name of the disease as well as the name of the organism, please have a notebook in your hand and take down those points. So they are the key points you will get, and you can score very well marks if you know those names. Okay. So dengue, it is a mosquito-borne viral infection. So what is that virus? It is a flavivirus. They can ask another question. Flavivirus has what type of? It is the RNA. It is a RNA virus that it has. So what is the mosquito? We all know it's Aedes aegypti and Aedes albopictus. Now what is the thing that you have to know here in dengue? The patient will come with mild to very high temperature, but they will have one characteristic that when they make the eye movement, it will be very painful. They will not be able to make the eye movement and they will have severe headache. Characteristic is the rash. They develop rash on the face and limbs and all. That is very characteristic. And their platelet count will become very less than 50,000 also. So that is characteristic with dengue fever. Why we call it as breakbone? Because they will have severe body pain, and that is the reason we call it as breakbone fever. Now how are we going to prevent? There is no such vaccine, but environmental management. Like what we are going to do? Proper sanitation, proper disposal of waste, mosquito, those vectors, all that management, all should be taken care for prevention against the disease. Like you have to eliminate the stagnant water, and so that the mosquitoes don't breed. So that health education has to be made among the population so that you can prevent. So that environmental hygiene is the way that you can prevent the dengue fever. Okay. So what is the virus? Flavivirus, RNA virus. Next key point is the Aedes aegypti and Aedes albopictus. Next we have, my God, I don't know how many of them have, they are scared about dogs. I am totally scared about dogs. Many people, if they'll have their pet, they'll say, please come in, nothing it will do. But I am scared of dogs, particularly after seeing the patient with rabies. It's not that all dogs have. Some dogs, they are infected with this virus and they cause this disease. So rabies, which we call the street virus. Okay. Now, before going into this rabies, I want to tell you one more thing. When people with dengue, they will come with emergency. What we call it as dengue hemorrhagic fever. We call it as dengue. I think in the acronym on the first class, we told you, yes, the hemorrhagic shock or fever, they will come with this symptom. The person will have bleeding through nose, mouth, sometimes even ear. They will have rash, black stool, restlessness. So these are some of the medical emergency they will come with. So that is dengue hemorrhagic fever. They will have bleeding because the platelet count is less. Yes, that capillary integrity is lost. They will start bleeding. Okay, so that is medical emergency. Then coming to the rabies, it is a street virus which we all know. So this rabies, September 29th is celebrated as the World Rabies Day. Yes, I don't know how many of them like pets, but sorry to say, this rabies, when you see a patient with it, my God, they will be suffering like anything. It's a zoonotic disease. What do you mean by zoonotic? Like it is going to spread from an animal to a man. Now what happens, these dogs, okay, they have this virus, and this virus is going to spread from the dog to the human. So what is that you have to know here in rabies? The person, once when they had the dog bite, they will develop what is called a phobia, because this virus will travel through the nerves and it can affect the central nervous system. So they have a phobia, particularly for water. What do you mean by phobia? Phobia is nothing but the fear. Okay, so they have fear for water, which we call it as hydrophobia. Like it will affect the salivary glands, they will have drooling of saliva, it will affect the brain and all that. Sometimes if we are not vaccinating, then it might even bring to death. So here that virus, the rabies virus, it will enter the nerves to spinal cord, the brain and all that, and sometimes they go to the entire of the nervous system and it becomes very fatal. They develop seizures and all that and they die also. So rabies virus probably through the dog. Okay, so it is a zoonotic disease. So they can ask, identify the zoonotic disease, which is not a zoonotic disease among that. So you can find out and pick out. Zoonotic means what? From animal to man, the infection is spreading. So the credit goes to Louis Pasteur. He was the one who developed the vaccine against the rabies. Next, coming to yellow fever. Now everybody know, first we teach in our medical students, we say that yellow fever, don't say that they have jaundice. Very rare. Why we named as yellow? It's because those days with this infection, these people will be quarantined. They will be put up in a ship which will have that yellow flag. So with that flag, any yellow flag, we will think that these people have a fever with a yellow flag. They are quarantined because of some infection. We call them as, slowly it came as yellow fever. And many people mistook that because of jaundice, not so. So yellow fever, when you look through, it is probably because of that arbovirus, flavi-arbovirus, particularly because of that same mosquito, Aedes mosquito. So here fever, they will have hemorrhage, that means bleeding, okay, and they will have inflammation of liver, they will have severe jaundice and all that. So it is the first human virus disease that was discovered, but as of we don't have treatment, but we have vaccines for yellow fever. So that you have to remember, flavi-arbovirus, Aedes mosquito. Next comes the chikungunya. I hope you all remember this chikungunya. My God, yes, it's something bringing about the painful joint that we get. Even I was a victim of this chikungunya once. So it is mainly caused by what organism? The chikungunya is caused by alpha virus. They belong to Togaviridae family. But what about the dengue? It is flavivirus, Flaviridae family. So that is flavi-arbovirus. This is alpha virus. So that is the difference. Second thing, chikungunya, we say, I said joints, broken joints. Definitely the joints, all the joints will be so painful, like you can't even do anything. So that is where the word came from. It is mostly by the Aedes mosquito. There it is by Aedes mosquito and that Aedes, that Asian tiger also, that mosquito also. Here the platelet count will not go that low. But in dengue fever, platelet count goes very low. Again children, we have dengue fever, chikungunya. Dengue fever, it is the flavi-ribovirus. Here it is the alpha virus. Here it is the, we call that as what? The breakbone fever. Here it is the joint, the broken joint fever. Here it is only that in dengue, Aedes mosquito, we had that Aedes albicto, that is that Asian tiger mosquito. Here it is purely Aedes. How we clinically differentiate? The platelet count. Here that platelet count is what? It will be around, say, it will be around some 80,000, 50,000 and less in dengue. In chikungunya, it will be around less than 80,000. That's what. So that is where we make the differences. And also the rash, torso, they will have it in the limbs and all with chikungunya. Face and limbs and all with dengue fever. Then another thing, and you know this Aedes mosquito, particularly do the daytime only, they come and bite and they keep spreading the infection. So this is regarding the dengue fever and chikungunya. You are all able to follow, students? Yes? You are all able to understand? Which is called the breakbone fever? Please put it in the chat. Please put it in the chat, which is called the breakbone fever. I am just looking for the answers. Very good. Yes, I want many of them to give response. Yes, what is the answer? Yes, excellent. So, dengue fever is called the breakbone fever. Next we have the COVID, the severe acute respiratory syndrome. Yes, COVID caused by the coronavirus, COV. So, here it is the coronavirus. Okay, so what it is? It is the mode of transmission is the direct contact or the droplet infection. It is affecting the respiratory tract and the digestive tract. So, in respiratory tract, what it is bringing about? The symptoms like breathlessness, sore throat, cough, okay, with sputum, okay, they have all this. In digestive system, it is affecting, and so they bring about the diarrhea, loss of appetite. Even if affects the brain, it brings about the change in the smell and taste sensation. So, this is regarding, and vaccine is yet to be discovered, and they are in the process. And again the treatment also, they follow the antiviral with a good vitamin supplement. Okay, so that is what they are providing the treatment at present for the corona. They are giving the multivitamins, okay, with the vitamin C, and they are giving with the steroids. They are managing the patient symptomatically at present. The vaccine, I think probably in another few months we will get it. So, next is the transmission through genitals. So, we have what is the genital herpes and genital wart. What do you mean by genital herpes? We have two type of herpes. Okay, one will affect the oral, the another herpes will affect the genitals. So, we say SV1 and we say SV2. Okay, so the one that affects the genitals, we call that as what we call. So, somebody has posted like Tamil, ma'am, Tamil lecture possible. Yeah, I can even speak in Tamil if nobody has any issues. Okay, I will just find out from next class we will do it. And coming with genital herpes, HSV1 and we have HSV2. HSV1 only oral lesion, and the other herpes will affect only the genitalia. So, here in males they will have painful ulceration in the urethra, and they will have a discharge of pus and all that. So, that is with them. Probably spreading, the mode of transmission is sexual contact. It is a sexually contracted disease. So, here in female again they will have what you called ulceration with vaginal discharge, foul smelling pus discharge they will have. Sometimes it can spread to the infants who are born during the delivery also. So, that is with it. Then we have the genital warts, which is spreading through human papilloma virus. Please take down, children, please take your notebook and write down human papilloma virus, HPV we will say. So, here you will have small wart like you will have like a small protrude like skin, like you have a mole. That mole itself, if it is elevated, how it will look? It will be like that wart like, and that will appear in the genital. So, that is also a form of sexually transmitted disease. And this genital wart is having a more risk for women to develop cancer, and this is also through sexual contact. Okay, so they will develop in the genital perianal region and all. So, quite common for the multisexual partners. So, that is with the genital warts. So, next we have AIDS also, but that is a separate big topic which we will discuss in the forthcoming session. So, now students, all of you, I wanted to answer this. Come on, be live. Yes, come on, cheer up. I want you all to answer this question. Chickenpox is caused by paramyxovirus, varicella zoster virus, rhinovirus, alpha virus. Please put it in the chat. I am waiting. Yes, very good. Please. Yes, many started putting the answer. Start posting it. I want everybody to participate. Don't see that others have put. I want everybody to participate. Yes, come on. That spirit should be there. Yes, come on. Be active. Yes. Students of mine should be active. Yes, come on. Yes, very good. Yes, Tasmim. Yes, come on. Very good. So, shall we move for the answer? Yes, it is caused by the varicella zoster virus. Okay. It is mainly a DNA virus, that is mainly because of the droplet infection from the infected person to the healthy person. Excellent. Very good, very good. Very good, students. Good. So, we will go for the next. Street virus affects kidney, CNS, lungs, eyes. Waiting for your answer. Yes, very good. Start. I want everybody to answer. Excellent, excellent. Very good, students. Excellent. Yes, let me put the answer. Yes, it affects the CNS. Can you tell me what is that streetwise also called? That street virus? What is that street virus? Can anybody put it in the chat? Yes, very good, students. You are right. Shivani, you are right. Very good. Yes, Shanmugam. Excellent. Yes, very good. Everybody are answering. Excellent. Yeah, super. Super, students. Very good. Yes, the answer. Yes, very good. Rabies. So, what is happening? Street virus, rabies affects the central nervous system. Very good, students. Excellent. Which pair of disease is viral? Okay, we are going to see which pair. Cholera, TB, AIDS, syphilis, mumps, rabies, tetanus and typhoid. Please answer. Oh, Shanmugam is Revati. Hi Revati, take care, you are doing well. Very good. Yes, Tasim, you are right. Yes, excellent, students. Excellent, very good. You are giving the right answer. Yes, mumps and rabies. Why mumps and rabies? Because mumps and rabies, they are caused by what? The virus. Others all see the bacterial infection, or it is a bacterial and a viral infection. So, you have chosen the right answer. Some have put 2. 2 means don't see one only. Syphilis is what? Last class we thought is, so AIDS alone is virus. This is not viral infection. These 2 are the viral infections. Very good, students. Next, Zig vaccine is used against street virus, chickenpox, German measles and poliomyelitis. Please answer. I am waiting. You are all doing good. Very good. You are all very interactive. Very good, students. Yes. Yes, fast. Zig vaccine. Again, I am telling you, think a little bit and answer. Zig vaccine is used against what? Zig vaccine. Zig vaccine. I think many are giving B. Chickenpox. Let me check the answer. Yes, you are right. It is not Polioma. For polio, I told you, polio vaccine which is called Salk and Sabin. Okay. So, for chickenpox, we give the, what is Zig? We give that immunoglobulin vaccine, right? So, that is zoster immunoglobulin vaccine. So, that is what is for chickenpox. But for poliomyelitis, I told you, no, that Salk and Sabin, that is the vaccine we give. Now we will go for the fungal disease. Okay students, so far I taught you about the viral disease. What are the viral disease that spread through the respiratory tract? We saw influenza, we saw common cold, then we saw the chickenpox, smallpox, measles. Then we saw what are the viral disease that can spread through the gut? The poliomyelitis. Then we saw about what is the rabies. Then we saw about, we saw poliomyelitis. And what is the other disease which can spread through your gut? What is the other disease we saw that it can spread through the gut? One is polio, the other one is the hepatitis. Then we have the transmission through the cocoon or through some animal bite, rabies. Okay, we saw rabies. Then we saw about the dengue fever, then the chikungunya. Yes, all these we saw. Then we saw about the spread through the genitals. The spread through the genitals is herpes infection. Yes, herpes simplex infection that affects the genitals. And then we saw the genital wart, which is affected by human papilloma virus. Now we are going to proceed to fungal diseases. So far it's clear for you all? Yes? So name some fungal disease if you have come across. What are the fungal disease you know? Yes, yes, very good. Candidiasis, which is called the oral thrush we say. And what about that ringworm infestation affecting the skin, Achilles flute? All these are all some of the fungal disease. So I think with viral disease we will wind up the session for today, and the fungal disease we will see in the next class. Okay. So any doubts you have students, you are able to follow the class? Yes? So I am winding up the session here. Thank you students. I will see you in the next session. Bye. Be safe. Stay happy. Bye.